Today I'm going to be teaching you on how to treat pile, which is hemorrhoid, completely, and how to prevent yourself from having pile if you are free, and how to avoid the reoccurrence of pile. So first, what is pile? Another medical name for pile is called hemorrhoid. Hemorrhoid is a swollen or an inflamed vein at the rectums and anus side, which can cause discomfort, itching, irritation, difficulty in stooling, or bleeding while stooling. So all this can happen as a result of hemorrhoid. There are people that it causes waist pain for them. They find it so very difficult to stool, or anytime they are feeling like stooling, they are very scared of going to toilet. So if you find yourself in this kind of categories, I would like you to pay attention very well, because today I'm going to be guiding you on what to do to save yourself away from pile. So the first thing you need to know, like I always say, is that if you don't know the cause of problem, it will be very difficult for you to solve that problem. So the first thing to do is to detect and know the cause of the hemorrhoid, the pile that you are having. So I'm going to be listing some causes of pile here so that you can know the cause of your own. One, there's what we call pushing too hard during defecating. So this pushing too hard is that when you are in the toilet, you are trying to push too hard for the stool to pass. So this can be caused as a result of chronic constipation. Chronic constipation means finding it very difficult for stool to pass through the anus, or staying for a long time without going to toilet. So all this can cause pile. Then we have chronic diarrhea, means visiting toilet often and often, all the times, either due to dehydration, typhoid, or any other causes. So chronic constipation and chronic diarrhea can lead to pushing too hard while trying to defecate, and this can lead to hemorrhoid. So if you have that kind of issue, you have to visit any consultant and have yourself treated, or visit a nearby hospital or a pharmacy to get the proper medication you really need to get yourself treated. So the second cause of pile is pregnancy. I discovered that a lot of women, 80% of women, develop pile after pregnancy or after delivery. So what are the major causes of this issue? One, during delivery, pushing when it is not yet your time to push the baby out can cause pile. I repeat, during delivery, pushing the baby when you are not supposed to push can lead to pile. The best time to push during delivery is when your cervix is dilated, which is when you are up to 10 centimeters. So a lot of women push the baby when it is not yet time for them to push the baby. And another thing it can cause weakness for them. So pushing the baby when it is not yet time for you to push the baby can cause pile after delivery. So we have to avoid this, and there are many medical personnel that always tell patients to push the baby when it is not yet their time to push, or the cervix is not fully dilated, or they are not well trained to guide people on how to do delivery. So all this can lead to pile. So you have to avoid pushing when it is not yet your time to push during delivery. It can cause pile for you in future. Another cause of pile after delivery is hormonal changes during pregnancy. During pregnancy, many people's hormone change. So when their hormonal change can lead to the change of the systems. So their system is not really balanced, and it can lead to either chronic constipation due to dehydration and other kinds of things in pregnancy. So those are the things that can cause pile after pregnancy. Then another major cause of pile is what we call toilet habit. Toilet habit means the way you do in the toilet. Please, I would like you to pay attention, because this is one of the major cause of pile as well. So toilet habit can cause pile. What are the toilet habits? Number one, sitting too long in the toilet. This can make you to create much weight on your pelvic region. And if there is much weight on the pelvic region, it will react at the anal side. in future. So if you make it as a habit to stay too long in the toilet, many people stay in the toilet operating phone or reading in the toilet. So staying too long in the toilet can cause pile. Then another toilet habit we need to avoid in order to avoid pile is your posture while stooling. Many people don't have good posture, or they don't know how to sit and stool. The best position to stool is squat. You have to squat, you have to bend. Don't just come and sit on the toilet seat straight that you want to pass or you want to defecate. So sitting straight on the toilet seat can make your anus to be squeezed, and when your anus is squeezed, then later, if you make it a habit, it's going to lead to pile. So anytime you get to toilet and you are sitting to sit to pass through, you have to squat, you have to bend your waist, or you have to place something that you can lift your leg up. Don't sit straight on the toilet seat. You have to squat, you have to bend. Do you get what I'm saying? So another toilet habit that many people have that can cause pile is staying too long before going to pass the stool out. There are many people that can keep stool. They feel like going to toilet, but they will hold it for too long before they go. So holding it for too long can cause pile for you. Do you get what I'm saying? So another cause of pile is age. So if you are Asian, there's a probability that the tissues around your vein can be reducing strength. They'll be losing strength. So it can cause pile due to the weak of the tissues at the rectum region. Okay. So another cause of pile also is what we call hereditary. Many people have it in their lineage. So pile is genetic. If you have it in your lineage, maybe your father or your parents have it, there's a probability that you may actually have it, because pile is genetic. Another cause of pile is infection. This infection don't probably lead to pile direct. What infection do is that when infection comes, like either salmonella or any kinds of infection, what it does is to create typhoid. So it can lead to this diarrhea that we are talking about, or constipation, which can lead to pile. Then another major cause of pile is what we call poor diet. Poor diet can cause pile. There are many people that eat hard food. Eating hard food often and often. They take bread, TDS, which is morning, afternoon, and night. Bread is their favorite hard food. Eating fufu all the times, eating yam all the times. If you don't eat fiber food, then you are creating pile for yourself. So you have to get fiber fruits. You have to make yourself get used to fruits and vegetables, because eating hard foods all the time can lead to pile. Then another cause of pile is what we call obesity. Obesity comes as a result of too much weight. So if the weight is much on the pelvic region, then it can cause pile. Then another cause of pile is dehydration. Like I said, if there is no much fluid in your body system, it can cause constipation or diarrhea. So dehydration can cause pile as well. So another cause of pile is your work, your job, your job habit. This job habit is that many people sit so long. Okay, there are many people that sit in their office from morning till night. They don't even get up to stretch their legs. So sitting too long can create much weight on the pelvic region, which can cause pile. There are many people that are into driving job. They can sit for long from Lagos to Abuja without coming down from the vehicle to stretch their legs. All this can create much weight on the pelvic region. So I would like you to pick your own cause before you can know how you can treat or manage it. So the next subtopic we are going to learn is how to manage this pile. So if you have this pile, what do you do? What are you supposed to do? So first, you have to know the cause and avoid the cause. So you have to be eating too much fiber foods. You have to be eating fruits. You have to be eating vegetable instead of overfilling yourself with fufu, gari, bread all the time. So you have to manage what you eat as well. Then you have to be taking much water. You have to get yourself rehydrated, because dehydration can cause pile. So taking much water often and often can lead to the relief that you have from pile. Okay, then if you have pile, like the place is swollen, you can actually soak a clean towel inside a warm water and apply that. Then you have to keep the place clean also. There are many people that have this habit of using toilet rolls or leaf. They go to toilet, what they do is that they plug leaf and use it to clean their bums. The best way to clean your bums is to wash your bums with water, not to use leaves or toilet rolls to clean your bums, because some are still there. The place is not clean. You have to make the place clean also. Then another way you can actually manage the piles is to get ice block. Many people apply ice block there. They make the place clean and get an ice block, just apply it for a little while and remove it. It can reduce the inflammation or the swollen there. The major way to manage this is to work on your diet and your lifestyle. Medically, we have many ways of treating hemorrhoid. Number one way is by oral medication. Oral medication like intake of vitamin B complex make you to avoid hemorrhoid. So most of the people we recommend vitamin B complex tablet for them to be taken often and often. It will help them, it will soft the stool in their large intestines, and it will work on their systems, and it will make the stool so easy to pass through the anus. Another drug that can be recommended for you is diarrhea. Drugs like Taflon, Broso, Pylex, all those drugs can be recommended for you based on your condition. So before you take all these drugs, you actually have to visit a consultant, explain yourself to them before they can know exactly the type of drugs that can be given to you. Then there are many people who recommend antibiotic for them if the pile is caused by either diarrhea or constipation as a result of bacterial infection that enter their body. Hydrocortisone cream, you get it, you apply there. It can reduce the swollen, the itchings or the inflammation there. So hydrocortisone cream actually works very perfectly at that place. Then we have another way of treating hemorrhoid, which is the surgical way of treating hemorrhoid. We call it hemorrhoidectomy. Hemorrhoidectomy is the removal of hemorrhoid, which is if it is big enough or is more than the stage it can be compressed, or more than the stage it can be treated orally. So you have to actually get involved surgically so that they can do hemorrhoidectomy for you, which is to remove it completely for you. Then there's what we call sclerotherapy. Sclerotherapy is to actually maybe deflate the inflamed hemorrhoid. So that can also help. If you have or you have been battling with hemorrhoid for a long time, you can visit a nearby clinic and tell them they observe it and see how it is, and they know exactly what to do. So these are the major ways you can treat hemorrhoid, which is pile, completely. So if you know you have been battling with this, the best way to do, or the best way to handle first, is to work on your lifestyle. Just as I said, your lifestyle is what leads to this pile. So you must work on the things you do, the food you eat, your posture in toilet, the way you live your life at work, the way you sit too long. Then you have to exercise your body often and often. You have to be taking too much water, so I mean clean water. So all this way, taking good foods like fiber foods, fruits, vegetable also, they can help you as well. So these are the very simple way to manage or treat hemorrhoid. So thank you so much, and if you know you have been having this case, or you have any question, if you know you have any question to ask, you can drop it at the comment section while I answer you. Please don't forget to share this video if it is very educative to you, so another person can actually learn. It can help others. So I would like you to help us share the video, and you can actually click on the follow button to get other lectures that we have been having, or the ones we are going to be having henceforward. Thank you so much. I am your brother, Abimaje Monday. Thank you.